Top 10 Real Reason American Healthcare is So Expensive. Welcome to our channel. Today we're diving into a topic that affects millions, the real reason American healthcare is so expensive. Brace yourselves as we count down from 10 to 1, uncovering shocking truths behind one of the most contentious issues in the United States. If you've ever wondered why medical bills can feel like a financial black hole, you're not alone. Stay tuned, because the answers might surprise you. Number 10. The complexity of the system. To understand the exorbitant costs of American healthcare, we first need to examine the complexity of the system itself. Unlike many countries with streamlined healthcare services, the U.S. system is a tangled web of private insurance, government programs, and out-of-pocket expenses. This patchwork model creates inefficiencies, driving up administrative costs that consumers rarely see. Did you know that approximately 25% of healthcare expenditures go towards administrative costs? This staggering statistic reveals a truth that is often hidden from the average American. As each layer of bureaucracy adds its own set of fees and processes, the consumer is left to bear the burden, ultimately leading to skyrocketing costs that can be felt at the doctor's office and the pharmacy alike. Number 9. High administrative costs. Building on our first point, let's delve deeper into those high administrative costs. Healthcare providers often need extensive staff to manage billing, insurance claims, and compliance with numerous regulations. This administrative maze can seem overwhelming, leaving many patients confused and frustrated. Additionally, hospitals and clinics must employ specialized billing departments to navigate the myriad of insurance policies, which leads to further increases in operational costs. In fact, a 2018 study showed that U.S. hospitals spend over $39 billion annually just on billing and insurance-related activities. Imagine the impact if those resources were redirected to patient care. The staggering reality is that the more complex the system, the more money gets siphoned away from actual healthcare services, leaving patients footing the bill for inefficiencies they didn't ask for. Number 8. Pharmaceutical pricing. Another major player in the realm of healthcare costs is the pharmaceutical industry. The U.S. pays significantly higher prices for medications compared to other countries. How is this even possible? Unlike many nations that impose price controls on drugs, American pharmaceutical companies are free to set their own prices. This lack of regulation leads to astronomical costs for life-saving medications, often forcing patients to choose between their health and financial stability. Some cancer treatments can exceed $100,000 per year. It's not just about the medications themselves. The costs of research and development are often cited as justification, but what patients don't see are the hefty marketing budgets and lobbying efforts that fuel these price hikes. The result? Millions of Americans are left grappling with tough choices regarding their treatment options, further exacerbating the healthcare crisis. Number 7. Defensive medicine. One surprising factor contributing to high healthcare costs is defensive medicine. In a litigious society, many healthcare providers order unnecessary tests and procedures to protect themselves from potential lawsuits. What does this mean for you? Extra MRI scans, blood tests, and consultations all add to the overall costs of healthcare. A 2010 report estimated that defensive medicine practices accounted for nearly $60 billion in unnecessary healthcare spending each year. This practice not only burdens the system, but also puts patients through unnecessary procedures, raising ethical questions about the motivations behind certain treatments. With fear of litigation hanging over their heads, many physicians prioritize self-protection over patient care, ultimately driving costs skyward. Number 6. Limited competition. In many regions across the United States, healthcare providers enjoy limited competition, which allows them to set higher prices without the pressure of market forces. Did you know that some areas have only one hospital or a handful of specialists? This lack of choice gives providers the leverage to charge exorbitant rates for their services. Studies have shown that in markets with higher competition, prices for health services are significantly lower. Without sufficient competition, patients find themselves with few alternatives, leading to a cycle of inflated costs and reduced quality of care. The stark reality is that when providers are not held accountable by competitive pressures, the only losers are the consumers who must navigate the high-cost maze of American healthcare. Number 5. The role of insurance companies. Insurance companies play a significant role in driving up healthcare costs. With a focus on profits, many insurers negotiate steep premiums and high deductibles, often leading patients to postpone necessary care. Did you know that about 44 million Americans are underinsured, meaning their coverage isn't enough to cover their healthcare expenses? This creates a vicious cycle where patients delay seeking treatment due to cost, which can result in more severe health issues down the road. Furthermore, insurance companies often impose restrictions on coverage, making it difficult for patients to access the care they need. The tangled relationship between patients and insurers creates a dynamic that not only complicates care, but also results in higher overall costs, contributing to the financial strain on the healthcare system. Number 4. Overutilization of services. Overutilization of medical services is another culprit in the escalating costs of American healthcare. What does this mean? It refers to the excessive use of medical services that offer little to no benefit to the patient. Think of it this way: the more services rendered, the more revenue generated. This leads to situations where patients receive tests or procedures that may not be necessary, all in the name of profit. A recent study found that nearly 30% of all healthcare expenditures in the U.S. are considered wasteful. This overuse of services not only clutters the system, but also inflates costs, making patients question the value of the care they are receiving. It raises a critical question: are we truly prioritizing health, or are we prioritizing profit? Number 3. Chronic diseases and lifestyle factors. The rising prevalence of chronic diseases in the U.S. is a major contributor to healthcare costs. Conditions such as diabetes, heart disease, and obesity are largely preventable and often linked to lifestyle choices. Did you know that nearly 60% of Americans live with at least one chronic condition? The treatment and management of these diseases not only place a heavy burden on the healthcare system, but also drive costs to staggering heights. Preventive measures could drastically reduce the incidence of these diseases and their associated costs. The question remains, why aren't we focusing more on prevention rather than reactive treatments? Investing in education and resources for healthier lifestyle choices could yield significant savings and improve overall public health. Number 2. The impact of aging population. As the population ages, the demand for healthcare services increases significantly. Baby boomers are hitting retirement age, leading to a surge in healthcare needs. With aging comes a higher prevalence of chronic conditions, necessitating more frequent and intensive healthcare services. By 2030, it is estimated that nearly 20% of the U.S. population will be over the age of 65. This demographic shift places an immense strain on the healthcare system, exacerbating costs and creating a challenge that requires immediate attention. As the number of seniors increases, so does the demand for healthcare providers, treatments, and services. The question is, how can we prepare for this wave and ensure that quality care is accessible and affordable for everyone? Number 1. The profit motive. At the core of the expensive American healthcare system lies the profit motive. Many hospitals and medical practices operate as for-profit entities, which drives up costs. The need to generate profits often overshadows the primary goal of providing patient-centered care. For example, Hospital mergers and acquisitions frequently lead to higher prices as competition diminishes. The focus on profit over patient outcomes creates a system that prioritizes financial gain rather than health. In fact, a 2021 study revealed that hospitals in for-profit networks charge patients an average of 10% more than non-profit hospitals. This profit-driven approach ultimately leads to a healthcare landscape that is more focused on revenue than the well-being of individuals. It's a stark reminder of the need for reform in a system that has veered too far from its intended purpose. Thank you for tuning into our deep dive. If you found this content insightful, don't forget to hit the like button and subscribe for more enlightening videos. Join us next time as we continue to explore important topics that matter to you and your health.